I want to discuss the signs of aging that happen with each decade. So we're going to go decade by decade. This is relevant because it helps people to understand what to expect as you get older, and it also may give you a map on some interventions that soften the signs of aging. The signs of aging start early, and 28% of women under 25 admit to regularly worrying about the signs of aging. This increases to 42% of women between the ages of 25 and 34, and it peaks at 54% of people or women aged 35 to 44. However, after you turn 55, this decreases. And so I don't know why it decreases. Do people give up on worrying about how they look, or do they become enlightened and how they look doesn't matter as much? I don't know. So in our 20s, we start to lose the baby fat in our face, and what happens is we start to look more like men and women as opposed to boys and girls. But with this loss of facial fat, we also start to show our motor wrinkles. What are motor wrinkles? They're actually wrinkles that we get when we're expressing or making facial expressions, and we get lines from that movement. And the areas where we're going to start to see this are the 11s between our eyes, so when we scrunch down. I have a lot of Botox on, so I can't do it. Our crow's feet and our forehead wrinkles. We also start to see pigment changes, which are brown spots that appear from sun exposures on our face and neck. When we get to our 30s, we often get our first gray hair, which is very traumatic for many people. We also lose some of that luminescence or luster in our skin. We also will have deepening of the wrinkles from facial expression, like our 11s, crow's feet, glabella, and our nasolabial folds. And also we have fat shifting in our bodies and face. And so when in your 30s, you'll really start to notice you have more rolls than you used to have in areas like the love handles. You'll also have it on your arms and thighs and places that we don't want it. We also get more pigment changes on our neck and chest. So in our 40s, we say that it's the new 20s, but we still have lots of changes that go on with our looks. Wrinkles that were present with movement are now becoming embedded, and they're there all the time. We also have fine lines and wrinkles that start to appear that are not associated with movement or facial expression. And we'll see this particularly around our eyes and around our mouth. The neck also becomes looser, we start to get jowls, and our elbows, knees, and hands also start to give away our age. So the signs of aging in our 50s and beyond get real, and it happens fast. One of my employees says that when you start to get older, you age in dog years, and I really do believe this is true, because I know when I'm at this stage in my life that I see big changes every single year. As opposed to when I was in my 20s and 30s and 40s, sometimes I'd look better than I ever did in my 40s than I did in my 30s. But now, every year I look a little bit worse, sadly. The bone starts to demineralize. This is coupled along with loss of collagen elastic fibers, which leads to more saggy, baggy faces and necks. And I want to emphasize the bone starts to demineralize in our skull, and so the support around our eyes and along our jaw actually starts to disappear. Our lips also get longer, and we get more lipstick lines in there. We lose the definition in our jaw, and we also have increasing jowling. And the marionette lines, these lines along here, also become a real situation. We also get more looseness in our neck, and we also can oftentimes get bands as well as waddles in our neck. There is hope, though. We live in the best era in history to minimize aging. And also, we have lots of non-invasive treatments that we can do. I also have looked at many studies that show happiness is a bell-shaped curve, and we experience some of our happiest years as we get older. So do not despair. If you have more questions on the aging process, please contact us at Contour Derm, and please follow us on Instagram, Facebook, and YouTube.